Hodgkin's lymphoma is a malignant lymphoma that primarily affects B cells. Unlike non-Hodgkin's lymphoma, it follows a more predictable pattern of spreading and has a high cure rate. It's most commonly seen in young adults between 20 and 34 years old. In non-Hodgkin's lymphoma, it's mostly seen in older adults above 50. Symptoms of Hodgkin's lymphoma includes painless lymphadenopathy, which is most commonly in the cervical lymph nodes, mediastinal mass, which may cause dyspnea, chest pain, cough, or it may be asymptomatic. B symptoms are also included, which consists of weight loss, fever, and night sweats. Generalized pruritus can occur months before diagnosis. A typical finding of Hodgkin's lymphoma is also Pell-Ebstein fever, which is an intermittent fever pattern where there are fever during 1 to 2 weeks, followed by 1 to 2 weeks of afebrile. And here are some illustrations to make the information stick. There can also be alcohol-induced pain in affected lymph nodes, although this is a rare finding but highly specific for Hodgkin's lymphoma. When diagnosing Hodgkin's lymphoma, blood tests typically show leukocytopenia or leukocytosis. It also includes anemia, eosinophilia, and elevated LDH and hypercalcemia. The gold standard of Hodgkin's lymphoma diagnosis is lymph node biopsy. There typically is present Reed-Sternberg cells with owl eyes appearance. Immunophenotyping is also done, showing CD15 and CD30 positive. The imaging methods used are chest X-rays or CT scan to detect lymphadenopathy. PET-CT is used to assess disease spread. The Ann Arbor staging method is used to stage Hodgkin's lymphoma. Stage 1 typically shows single lymph node areas or one extranodal site. Stage 2 shows 2 or more lymph node areas on the same side of the diaphragm or extranodal involvement. Stage 3 shows lymph node areas on both sides of the diaphragm or extranodal involvement. Stage 4 shows disseminated disease affecting organs beyond the lymph nodes. Hodgkin's lymphoma is highly treatable. The first-line method is chemotherapy. For stage 2A or below, ABVD regimen is used, which is a 1-day chemocycle. For stage 2B and above, BIACOP regimen is used, which is a 8-day chemocycle. Radiotherapy is rarely used, and it's mainly used in stage 1A. Supportive therapy includes anemia treatment, analgesics, antiemetics, and antibiotics and GCSF to prevent infections after chemo. Hodgkin's lymphoma has a high cure rate. The 5-year survival rate is 80 to 90%, and in children it's above 90%. Early detection and treatment significantly improve outcomes. So to recap, Hodgkin's lymphoma is a type of cancer that primarily affects B cells, often seen in young adults. It typically presents with painless lymph node swelling, B symptoms, and sometimes a mediastinal mass. Diagnosis is confirmed with lymph node biopsy showing Reed-Sternberg cells, and treatment mainly involves chemotherapy. The good news? Hodgkin's lymphoma has a high cure rate. If you found this video helpful, give it a thumbs up and subscribe for more easy to understand medical content. And if you have any questions or personal experiences, leave them in the comments. See you next time.